Bustos.
All righty, thank you, Mr. Chair. And Secretary Wilkie, I want to thank you and your team for being here with us today. I'm actually going to start off a little bit where Chairwoman Debbie Wasserman Schultz started on the question about PPE. And Matt, if I have any time, I want to go into testing a little bit as well. And you may recall this, Secretary Wilkie, when you were here on March 4th talking with us about your budget request. I asked you about the VA's ability to respond to the coronavirus. So that's going way back to March 4th. At that time, here was what you answered to my question about your preparation. You said, this is your quote, "We train for epidemics. We began moving on supply chain and preparation really before this became a national issue." That was your quote to me on that date. You assured us at that time that the VA was uniquely prepared among government agencies to respond to the coronavirus, and you testified that your agency had been, quote, "augmenting the supply chain," end quote. So those were the assurances on March 4th. Then let's fast forward a little bit to late April. Dr. Stone, the executive in charge of the Veterans Health Administration, described that your system was facing severe shortages, with some of your hospitals near, quote, end quote, austerity levels of personal protective equipment. So again, you talked about your agency training for epidemics. You began preparation early, yet it was about a month later that your hospitals faced this dire situation. So wondering what the disconnect was in that very, very short amount of time between what you told us as a committee here, subcommittee, and then what Dr. Stone talked about just a short time later.
Well, there isn't a disconnect. What happened in between the time that I testified and the time that Dr. Stone delivered those remarks was that a national emergency was declared, and that the provisions that we made for independent supply chain and equipment was disrupted. We no longer had access to that as things flowed into the national stockpile, and that equipment was spread across the country. I mentioned earlier, I'll do this really fast, I'm looking at ways to prevent that from happening again in the event that this thing boomerangs back on us in the fall. But that is what happened. But I think in the rest of Dr. Stone's remarks, he probably said that we did not fall beyond 2 weeks of supplies in any of our hospitals. We never ran out, because we have the ability to do what they call the Navy cross-deck. There are huge swaths of this country where this virus is not impacted. If you look at North Dallas to the Canadian border to Idaho down to New Mexico, there are very few patients. And we were able to move supplies from those areas into areas that were hotspots, particularly in the northern part of your state, where we also opened up our hospitals to civilians.
So do you have what you need now? I mean, I know you talked a little bit ago about your level of supplies, but you also just mentioned in your response to me about should this, we have a second wave that really kicks off. Yeah. How are you also mentioned the supply chain. So talk about if the numbers do tick up to a much greater level, and the supply chain issues that you mentioned in your own opening remarks, how's this all coming together, and what assurances can you give us, give the veterans, give the employees that you will be ready?
Well, we are marshaling resources and storing them up, okay, at a greater pace than we had back in February, which was right before I testified. Mm-hmm. I have been also talking to CEOs of large corporations to make sure that as the national emergency subsides, we start getting large numbers of equipment from them, everything from masks to gowns. So that is the plan. I'm establishing depots across the country. It's an old military model. But I have to be honest, and the chair knows this, I said right after I testified and the national emergency was declared that we were not working in optimal conditions. And we had to compensate for that. Thank the Lord, we've had a very, very low incident of infection amongst our employees. Right now, of the 330,000 employees we have, there are 500 active infections. But we don't want to face another situation where I come and tell the chair that it is not optimal. And I think I've been very clear in stating that we don't want to go through that again.
All right, my time's expired. I yield back.